Hi, you've reached the voicemail of Hannah Brett with Connect Call. Just leave a message and I'll get back to you as soon as I can. Thanks.
1 for more options.
Hey, Hannah, I just want to circle back like we had discussed about my son coming to your program in a week. I'm pretty much stuck right now. As I had told you before, my son was at another program. He relapsed for a day. That program had recommended, because he had relapsed, that he needed to go into some sort of medical detox, withdraw off all the substance he was on. I was confused on why on one day he would need to go to a medical detox, but they were adamant. We're now on day 10 at this detox, and by the way, he's been at this detox now 3 times by 2 different facilities he was at. They both had recommended, and they're kind of holding him there and adding meds and taking meds, and it's just kind of a mess. So if you can call me back and help guide me, that would be great.
Hi, this is Hannah Brett with Connect Call. I often say I do not have a clinical background, but I do have a PhD for picking up the phone for families in crisis. Is that cheesy? It's cheesy. I'm trying out a bunch of different taglines. So today, I like to start with a story that I feel that people can relate to, and also for the subject that we are talking about. And I am going to get into this, but the big subject today is going to be about ethics in residential treatment, or just in the treatment world that we work in. And I often, when I think about what is ethical, okay, and what is not, I think of the stories happened too many times, unfortunately, where I used to, for many years, worked for an adolescent and young adult program. And I got a call one day from a family where we were set to admit a young adult who was coming from another state, from another detox. This was his 3rd treatment stay in a very short period of time in this area, but he kept relapsing and being sent to the same detox, which already my what's the saying? My ears perked up. And so I let this dad tell me how, his son was in this detox. We were waiting for him to medically clear from all substances. And mind you, he, not taking away the severity of the relapse, but he was, I think, out using for about a day, right? The substances he was using should have kind of cleared out of a system in a few days within maybe some detox assistance. But I didn't even think he needed the detox at the time either. We were going on day 8 of him still being at this detox. And the dad said to me, I'm having a really, really, really tough time with this detox wanting to be cooperative with the new admission coming to your program. And so that's typically when I jump in and I intervene, and I will speak to the admissions director. I will speak to the clinical director. I'll speak to even the CEO or the director of business development and kind of make that relationship and find out kind of what is going on with this individual. What is the set date for discharge? What medications? I mean, we already kind of checked a little bit. And so when I called this admissions director right out the gate, I got very defensive attitude. Also got, Again, I don't have a medical background. I don't have a clinical background, but my clinical team who had assessed him and our doctors were looking at the meds the detox had put him on. And in our opinion, a lot of them were not necessary. And we're going to talk about that. But sometimes, unfortunately, that will happen. So to keep that individual into treatment for a few more days, run their benefits, et cetera, et cetera. So when I was talking to this woman about when this young man, let's say his name's Michael, can come to treatment with us, she said, well, I'm not sure about that. And she said, I have this amazing relationship with Michael. Michael can even call me after hours. He has my cell phone, and he's not really comfortable with coming to your treatment center. Immediately, I was like, ruh-roh. This isn't good. And we're going to talk about all the reasons why it isn't. I then proceeded to kind of then grill her on his history of, so tell me this. So in the past few months, he has gone from this facility back to you for detox for relapsing, then to another facility in the area. Coinkydink, he relapsed again and went back to you guys. And it just seems like he's been on this kind of rodeo with you, because I knew what was happening and I knew this was kind of some unethical stuff happening. And I kind of I knew it just smelled bad. It was just all bad. And my goal was to protect the family, protect the individual, and get him to us safely. When I asked that we had a discharge date, she also let me know she didn't need the transport that we had individually hired from an independent provider. That's because her boyfriend does all the transports, meaning flying the client to the new facility. Again, ears popped up. And when I asked for discharge date, etc., she was very resistant to the point where I pretty much had to let her know this is what I think is suspect about all this situation. And unless we can kind of coordinate a date that would work for the family and us, I might have to take this a step higher and talk to somebody about what's happening here. So my guest here today, is one of my dear friends and colleagues, and someone I truly look up to in the industry for so many reasons, Nikki Soda. And Nikki Soda knows a lot about ethics. And so, Nikki, after hearing that story, what do you think?
Well, first, I want to thank you for letting me come on the show to talk about something that I am extremely passionate about and that is so important for the general public and families to understand. And
Right.
you talked about your ears perking up, and I call those red flags too. And when you start to feel kind of uneasy, like, oh, I'm not sure about this, typically I want to encourage you to go with your gut. And so in that story that you just shared, there's a handful of examples there of red flags, not only slightly coming up, but like waving in front of your face that
Right.
something is not right. And so I think what the tricky part is, Hannah, is that when you have families in distress that are going through situations like this, they're in a panic and they're not understanding fully what's going on. And that's
Right.
why it's imperative that we have some more oversight and regulations in situations like this. And
Right.
um, so, as you said, there's a handful of things that are wrong with that story, and I'm curious what the outcome was.
The outcome is we finally got him to come to us. The outcome was I did write a letter to his CEO saying, as someone in the industry, this is what I observed. I'm happy to have a conversation with you. But from everything I saw and how exactly the boundaries were broken and how this kid kept coming back to this detox, I was really honest. I said, all of it looks really suspect, which only tells me that, unless we have a conversation where you kind of explain how you do things, I will not be using you as a detox in the future. I just want to stress for the viewers and listeners at home who, when we talk about ethics, think about it this way. In Wall Street, where our money is protected, right? We have the SEC that regulates, right? In the treatment industry, when we're talking about someone's mental health, substance abuse issues, someone's life, we have no one policing us. So again, a big reason of why I wanted to do this show was to really shine and show people not only resources, but who the good guys are, who the good providers are, how to look for the good things and the good treatment, and not to be discouraged. Because unfortunately, like anything else, without this kind of regulation over us, it can be the Wild West and people will take advantage. But my hope is everybody will tune in and listen to us, and then the world will be a perfect place. So I guess
I agree with most everything that you said, but I'm going to say that there is a little bit of oversight and regulation. Like if there wasn't, it would be completely pandemonium.
correct. I'm
So
sorry.
so
And that's
there
why I have you
so
here,
there
because you're going to educate me.
definitely is where we can be a lot better. And so that's something that I'm hoping to dive into. And I've been in the field for a long time, and I've covered things from I've worked in admissions, I've overseen marketing, alumni, I've done policy, government relations, and there is a lot of people in this field who do things the right way and who are doing really good work. And you touched on
True.
that. Unfortunately, there's people that are not. And
Right.
so I think what the tricky balance is finding more oversight. And so I think that those are some of the things that we'll dive more into. But there is good people out there.
All due respect to my colleagues out there, but for years, we've all gone to these conferences where there's these pre-ethics meetings or this ethics about ethics circle with the ethics meeting. And I never know or understand what those actually do? And maybe you can tell me, and maybe there is more, but from where I'm standing, like you said, we definitely need more oversight. So, let me kick off like this. When we think of ethics in residential treatment, like what is one of the biggest misconceptions or myths that you would like people to understand?
Sure. So a couple of things, and I think that that's a really good question. I think that ethical treatment, it's not just bad behavior, right? It's proactively building systems that support safety of the patients, transparency, and quality care. So I think that those are three of the things that we really are looking at the most with ethics. Many people can say, just don't do illegal things. And in reality, that's ethics and treatment is really about small systematic changes as opposed to just they're doing bad things. Families, Hannah, and I know you work with so many families, they often assume that if a treatment center is licensed, then it must be ethical and that it must be ethical and clinically sound. And that is not always the case. So licensing, as I see it, is kind of the floor. It's not the ceiling. And so high quality treatment, it goes far beyond the minimum of just being licensed. License is really and truly just the very
The bare minimum.
Very minimum. Yeah. And the last thing, another misconception is that all treatment centers are the same. And so I want to say facilities are so vastly, wildly different,
Totally.
and families in crisis don't know what to look for. And so I think there's a list of things that I look for when I'm looking at a brand new treatment center that I haven't been to in person.
Right.
And so I'm happy to get into that later. So that's kind of the
Maybe you could do
nutshell
that
of
for
ethical
our
treatment.
viewers and listeners, because I like to give these show notes at the end with resources and kind of tangible tips. And kind of, I used to do it too when I, was doing marketing for treatment centers. I used to get so frustrated with families, not frustrated with the families, but frustrated that, not frustrated, the wrong word. Of course, they didn't know the right questions to ask. So what I would try to do is if they were looking at young adult programs or adolescent programs, I would create like a hot 10 list. Ask every admission team these questions. Don't just look at the price. Don't just look at it takes my insurance. And we're going to get into my whole shtick about how this is the biggest investment in your life, But before I jump into that, like, what do you think, like, when we've seen the good, we've seen the bad, we've seen the ugly, but like, how do you define good ethical treatment today? And what are some of the biggest gaps you see existing?
Sure. Well, let's start at one from a marketing perspective and looking at a website. So the things that I look for in a website, does it have the treatment staff listed?
Yes.
Does it have
Thank
pictures,
you.
titles? Bios are nice to have, but if it does not have pictures of your staff, that is a ginormous red flag.
Huge.
So that is one. So one of the things that I wish I could get past would be that treatment centers can only use actual photos of their treatment center on their website, that no stock photos allowed. When I worked for a treatment center in Colorado, they were very big on only having authentic photos that they take.
Right.
I've seen a lot of people that are deceived by going to a website and seeing a beautiful picture of a treatment center on the ocean when in reality it's in the shopping center in the middle of the city, nowhere near the beach.
Right.
So I think that is one deceptive. So staff, you can't trust what you see on the website necessarily as far as photos. And then, so some of the other things that I want to see that I want to see as a professional, and then I'll talk about family. Does that work?
Beautiful.
So as a professional, I personally am curious what the data and outcomes are and how they're finding that. And so there's one thing for a treatment center to say, we have a 99% success rate of patients who are discharged.
Right.
Okay, how are you coming up with that? What measurement tool are you using to find your data and outcomes?
Right.
And do you have data and outcomes that you are providing? And so that's one of the things that I'm looking for.
Can I just interject and say that to families listening? Because I know you all want outcomes. Outcomes are great, but I have to say, as someone who also worked at a couple treatment centers, it's hard to get those outcomes because if someone's doing not well, they're not going to pick up the phone and say, sure, we'd love to do a survey with you. You know what I mean? And so as good as they can be, they're not, I personally find, totally accurate. But carry on. Sorry, I just wanted to say that.
Yeah, no,
sometimes.
that's a very good point. But even when they do have outcomes, again, I'm gonna go back one step and be like, okay, well, how are you getting these? So
Right.
I think that that's a good one. But going back to your question, Hannah, sorry, I diverted from it. You had asked about the good, the bad, and the ugly, right? In the industry, that was the
Yeah.
question.
Right.
Yeah. So for me, one of the good things is, do they have clinically centered care? Right? Are the decisions guided by what's best for what's clinically appropriate and what's
Right.
best for the patient? And transparency is the other one. So clear
Mm,
communication around pricing, going back to the staff,
thank you.
around insurance coverage, and what clinical model that they're having. So there should be no surprises
No surprises.
when you are talking to the admissions team and then for what happened.
Or
It's
bait and
always
swish. Bait
correct.
and switch. I've dealt with that a lot lately, even in the industry referring a friend to a treatment center. I saw it where they said, oh, you'll get this service, that service, this service. And then when
Right.
we got in, they said, no, you only get those services if you stay 6 to 9 weeks. And I was like, you
Correct.
didn't say that on the admission call. So,
Correct. I
yeah,
think pricing is one of those things too that should be pretty clear cut. And it shouldn't be
exactly.
so elusive, like, oh, we'll get to that. We'll get to that. You should be able to
Correct.
have transparency on the price and transparency on the service that you're getting.
I agree.
Something that's very important to me too is, are you providing evidence-based clinical services? And so you will find that sometimes families can get swayed by real fancy amenities that are going on in the treatment center.
Right.
You know, is acupuncture an evidence-based clinical service that's proven to help? And actually, I don't know the answer to that. But so finding out if the clinical services that they're provided, have they been proven to be good? And that gets a little bit in the nitty-gritty, but you should at least have an overview of that on the website or within the materials that you're looking at. So
I've also
yeah,
always
please.
said, when I was, marketing all these years, any facility that leads with their buildings and their amenities, already I'm not trusting, because yes, that's a lovely building. Yes, that's awesome. They get their own room with, this thread count of pillow, but let's get to the meat and potatoes. What's the treatment? Obviously we want our young adults, kids, whoever, comfortable, but if that's what you're leading with, sometimes that can be suspect of whether that's even a good program.
100%. I completely agree. And when I go on tours and they try to show the fancy ancillary stuff,
Right.
like I don't care about the gym. I don't care about the gym.
No, I know. I'm the same. Yeah, I don't care about what shampoo and conditioners are in the showers and that, they get their own room. I mean, I do
Right.
care. I'd like to see where people are sleeping, but again, that I cared when I was choosing treatment for myself as a young adult. And I tried to choose, and my mom said, no, you don't get the horse in the sand and chill out. We're picking. But what are, so we've talked about, I think, a lot of red flags,
Mhm.
so I think just to keep it simple for families, and I'll say this, if it seems too good to be true, it probably is, right?
For sure.
And so are there some red flags that we haven't mentioned that you want to talk about with residential treatment still?
Yes,
Yes.
definitely. So overpromising things,
Yes.
guaranteeing. There are no guarantees. With
I love that.
as much as I'm a mama myself, like as much as I would want to hear that, anyone who promises you a cure or who
Right.
promises guaranteed success is
Right.
full of shit.
Full of shit.
Yes. So I would say that overpromising is a red flag. If there is no clear clinical model that they're
Mhm.
presenting, or weak staffing. So I would encourage the treatment center to at least have master level clinicians,
Yes.
because you don't want an intern. You don't want an intern.
Right.
I'll just leave
Right.
that at that.
Right.
There's two more things that I would definitely suggest. A big red flag, Hannah, and you definitely probably have experience with this, is pressure tactics. You should not, ethical programs do not use fear. They don't use sales techniques.
Right.
So they're going to be authentic. They're going to want the best for your child or for your loved one. And you're not going to feel so much pressure like, I've got to do something right this second.
Right.
Urgency definitely is important, but they shouldn't make you feel bad.
Right. Right.
Do more.
No, go. I love all these, by the way. I was just thinking too, but go.
If they don't have licensure or if they have an inconsistent regulatory history. So you may say, what is that?
What
Every
is that?
residential treatment center needs to be licensed by the state. I personally would not recommend a loved one to a treatment center if it is not at least Joint Commission or CARF accredited. Either one of those things would be located on the bottom of the website, if they are. And what those just mean is that they have gone through extra steps to be able to be accredited. And so to me, having a license and being accredited is very, very important.
But I also want to stress, and not to scare the viewers and listeners, because yes, CARF and JACO is very important. That's the bare minimum for me. Like, that's the bare minimum, because I've also seen programs find tactics to be unethical with even being JACO and CARF accredited, That's
sure.
why you're here and we're talking about, obviously we need more. Nothing against JACO or CARF. At the end of the day, good or bad, this is a multi-billion-dollar industry, like major money in that a lot of people need mental health treatment. A lot of people need treatment with their addiction. And so because of that, again, we will see people doing unethical things. What else? What other red flags? Because I like your list and you're educated. Okay, so what were you saying before about checking their regulatory history? Is that what you're talking about with JACO and CARF, that every year they
Correct.
need to be? Okay.
It is.
Okay.
Yeah.
How does one find that out? Just at the bottom of the website, and that's it.
The bottom
right?
of the website, they're going to have either a Joint Commission or a CARF logo,
Stamp.
and
Yeah.
so that's gonna allow them. Now, this really gets in the nitty gritty. There are some very salacious places. This is illegal to do, but that will have the logo on there that aren't really accredited. But for 95% of the time, if they have it on there, then it's legit.
Okay. What are some other red flags? Let's go. Let's keep going.
Would want to know. So depending on what type of treatment center you're looking at, what's their discharge planning afterwards? And so if you're at a 28-day facility, what are some of the options going to be for my loved one's aftercare plan? And then, yeah, I think that's an important one.
I love that. Because we're going to be doing an episode on that where, and I don't want to completely go rogue, but the whole mentality of 30-day treatment, which was, originally designed by the military. My point is that if you are, admitting to anywhere for 30, 60, 90, it is so important to ask the questions, what happens next? Because there is a next. And sometimes next is just as important, if not more important. And you don't want to be working with a facility where it's all about you just paying them and them not
Correct.
thinking of the next step. Because as I always tell the families when I'm working with them, you also want to be able to spread your finances out over a year, hypothetically, possibly. And so if you're getting a program that's just ready to take it all and not
look at what comes after.
Look it up. And again, and I think just like the main thing too, because it just does happen a lot with me, is if any treatment center, I'm going to say it again and again and again, that says, don't worry about the finances, don't worry about running the benefits, your insurance is taken, blah, blah, blah. Don't do it, because you're going to get a big old fat bill at the end. Make sure all the programs I've worked with, we run those benefits prior. We are very transparent on this is the deductible. This is what your cost will be, no surprises, so.
Yeah, no, you're exactly right. And good programs will do that. I'm going to piggyback on what we're talking about for continuing care. So I currently am the co-president of the board for TPAS, which is Treatment Professionals and Alumni Services. I am very passionate about alumni. And so that's one of the things I would say too, to look at, see if the treatment center the treatment program that you're looking at, do they have an alumni program?
That's a really good point.
And so majority of them will have an alumni tab at the top where you can see something that families could look for as well.
And it's the most telling. That's your outcome study. If you have a strong alumni program, that's your outcome study. And it's so, I'm glad you pointed that out, because that is so important to ask. Again, at the end of the show, we're going to give you guys probably a list of questions to ask admissions directors and people you speak to. And why I also stress this before we get to the next question is, and I can't say this enough again because I've worked with so many adolescent and young adult families. You know, when I think about my girlfriends right now, who all their daughters or kids are looking at colleges, you know, it's a major investment. You are traveling to the school, you are touring, you are asking the right questions, you are taking the time because
Right.
you possibly are going to be writing not only a big check, but this is your child's education for the next 4 years. I only wish, and I know it's different maybe, because a lot of times where I ask families not to plan in crisis, they do plan in crisis.
Right.
But my wish for families is to do the same due diligence, if not more, when it comes to your loved one going to treatment. This is about someone's mental health, someone's life.
Right.
This to me, I don't care if you got into Harvard or you're on the captain of the Yale swim team. If you don't have your head together, you know what I mean? None of that matters. And so I wish, you know, a lot of times I would get like a mom or a dad or like an aunt calling me, getting the information saying they're going to get back to everybody and tell them about, you know, the program. And my thing is like, is this how we would be doing the schools? And if so, that's fine. But I just feel like this is such an investment that I want everyone to feel good about this. You know what I mean? Press pause, just slow down. Even, you know, and you know, because we've spoken to those families in crisis where they're like, we need to act now. He wants to go right now. He's detoxing right now. She is accepted. She wants, you know, and I'm like, slow down. Because we're going to rush them in and then we're not going to be equipped to deal with when they want to come out. And we also are going to rush the process in finding the right program. And so take the time and please, even if you've only been recommended one program, I always recommend, and if you're speaking to a good program, they will give you 2 other options.
Correct.
At least look at 2 to 3 programs and really assess what you think is going to be the best fit.
Completely agree. It's tricky too because you plan for college, right? No one wants to plan that their loved one is going to go to treatment.
Of course.
And so that makes it tricky because who wants to read about what, you know, steps to take if you need to send a loved one to treatment. So majority of the time it's coming in a moment of crisis because it's not something you want to plan for or you think you need to plan for.
Right. And again, part of the reason I'm doing this show, Connect Call, is to really highlight the good guys out there. I always like to say, Nikki, I am a connector, but I'm a collector. And I think you know this about my relationship with you is, you know, when I see people and I meet people over the past 18 years that I know just get it and will like just are amazing providers, I want to do my best to scream to the whole world that these are the people you should be calling. These are the good guys. These are the helpers. Speaking of which, because I think this is also a misconception out there, thanks to some movies that are out there and people terminology. What is the difference? Can you explain to people like you and I, who in the past have marketed for treatment centers, right? Where we do get these family calls, and because we may not have the clinical background, or I don't, but over the years, what I've been able to do is hear the story from the family, kind of assess a little bit, see if they would be a match for our program, and if not, give other options based on the tours that I've taken and the great programs that I've seen, because that's another piece. If you've got a marketer or somebody on the other end of the line, they're like, we can only do this work. We are the one. That's also suspect. But what is the difference between someone like us who speak to families and assess and educate and are a marketer, and what this patient brokering is?
Sure. So I think,
which is very unethical.
It is, and it's we'll dive into patient brokering in just a minute. So there's a handful of things. So what a legitimate facility is, what a legitimate, good, ethical facility representative when you're talking to is going to do is they're going to educate the family on the program's model, the staff, and the clinical fit. Okay. So that's going to be one of the first things that they do. They're going to make sure to ask clinically appropriate questions, pre-admission questions. They are going to explain cost and insurance with transparency. They are also going to provide alternatives, as you and I talked about. When a program is not clinically appropriate, they're going to do that. And So those are a couple of things that a good facility is going to do. What a patient broker does, they're getting paid per person or per head, which is so awful to say. They have no responsibility for any clinical appropriateness. All they're looking at is a term called heads and beds.
Which I hate.
I do
But
too.
that is
I do too.
the term in the treatment industry, heads and beds. Continue.
And they're going to use fear, urgency, and false promises is what a patient broker is going to do. They're going to offer inducements. And so what inducements are free flights, which is, one of the red flags, waving with both hands in front of you.
Yes.
They're going to offer things like rent and gifts. So also they're
Really?
going to offer, they're also going to offer to sign your loved one up for insurance potentially. That is also a red flag.
Yeah,
Another
no
one.
marketer should be giving any family, like, we may encourage you and say, like, if you're under state insurance and if you would like, to use private in-network insurance, we would recommend maybe getting a policy for that loved one. But we're not allowed to set it up, tell you which policy to use, any of that. So,
Right. A patient broker is going to avoid any transparency about where the money's coming from, or they'll say, oh, don't worry about it. We've got it. Don't worry about it. And they're not going to want to get into the nitty gritty. I've used that term twice. I don't use that very often. Nitty gritty.
I like your terms. You haven't said dang yet today, and I've been really waiting for dang. Anyway,
we still have some time. So they're not going to be very transparent about the way that things work. They're going to want you to see a nice, shiny, glossy visual and get the patient in. So how to identify the differences? I think something that's really important, Hannah, because a lot of times if you Google, let's say I live in South Florida, so if I was to Google, residential treatment center, but that's not a good example. Let's say I'm in the Midwest. I'm from Missouri. So let's say I'm in Missouri. And I Google residential treatment center. What happens is a treatment center that pays the most is more than likely going to come up first.
Yes.
And it can have a deceptive name. So it can make me think I'm looking at a treatment center in Missouri and it has a 1-800 number. So what I would really encourage families to do when they are calling is ask who employs them and make sure that they are an employee of the treatment center that they think that they're calling.
That's happened to me. I've called a couple programs on behalf of a family and I was in a rush and I did the 800 number and I could tell right away it wasn't what I was calling because it was a totally different state. They didn't have an accent. And I remember saying, is this the program and they were like, don't worry. And I was like, no, I am worried. This is the program I want to speak to. Is this the program? So I think, again, these are things we're going to be leaving as like takeaways for you guys to like really please like do these things because people have got so I'm glad you brought that up because people have gotten really swift with that where you think you're calling a program and you're
not. And so you deserve to have an answer. And that goes back to the transparency part. There should be no stumbling over who they work for.
Right.
So
I also saw with the brokering, I was reading an article a while back and I couldn't believe how invested some of these brokers were. Like there were some brokers who would like their territory, let's say was Boston, right? And they would literally like immerse themselves in the AA community or whatever, recovery community and kind of just either induce or just wait for that relapse to happen, but they leech onto these individuals to the point where, like in this article I read, it was these two guys who had met in a meeting. The one guy was supposedly using and got the other guy to use and said, let's both go to treatment together. I know a place we can go to, bought the tickets for that guy. And they flew together. And then the other guy we found out was just a broker. He didn't even really use. It was just kind of this tactic. I mean, it can get really slimy. But
it can.
Again, if it sounds too good to be true, it is.
Too good to be true, it is. If it sounds too good to be true, and I have found too that if a facility has to repeat how ethical they are, they're usually full of shit. If somebody is going to start a statement and say, I'm so ethical, XYZ, it's usually not. You shouldn't have to start a sentence with.
What do I always say to you? I say this to everybody. My mother taught me this. When people talk about like how much money they have, right? Or how much love they have in their relationship. Anybody who is just overzealous about anything like that, they typically don't have it, and it's not trustworthy, I think also, when we talk about red flags, in treatment, I think, another area, again, going back to please talk to 2 or 3 different providers. That includes transports, interventionists. I just dealt with this recently where I had a transport who was recommended actually by a church. And this individual was delaying, basically had to transport a kid from Atlanta airport to this facility, right? And kept saying all these reasons why they kept missing the flight. And typically when a transport and interventionist miss a flight, it's because the intervention went bad or the client has run, right? That didn't happen. They just found all these reasons of why they couldn't catch that flight, knowing that if they missed the window on that Friday to get the clinical assessment, then they would be with that individual over the weekend and they could charge the family to babysit and kind of be a sober companion. So again, why I say this, and they were totally, extremely overpriced. So again, what I say to the family, before you write that check, right? Before you just hand a bunch of money over to somebody, find 1 or 2 other people that can do the same thing, please, and compare and contrast. Thank you for tuning into this episode of Connect Call. As we conclude, remember that insights shared are intended for informational and educational purposes only and should not substitute professional medical advice, diagnosis, or treatment. We strongly recommend consulting a qualified medical health professional or healthcare provider for personalized advice tailored to your unique needs. Your mental health journey is important, and having the right support is essential. If you're experiencing a mental health crisis or require immediate assistance, please reach out to a mental health provider or emergency services in your area. We're grateful to have you as part of our community, and your well-being remains our priority. So follow us on social media to stay connected, and be sure to catch one of our episodes on our YouTube channel. We're here to support you every step of the way.